What if lung cancer targeted therapy stops working? Imagine starting a treatment that targets specific changes in your lung cancer cells, only to find that after some time, it no longer works. This is a common situation in lung cancer treatment, especially with targeted therapies designed to attack particular molecular features of the cancer. When these therapies stop being effective, it's usually because the cancer cells have found ways to adapt and survive despite the medication. One major reason is what's called on-target resistance. This happens when the cancer develops new mutations or changes directly in the molecular target the therapy is aimed at. For example, if the therapy was targeting a specific gene mutation, the cancer might mutate that gene, making the drug less able to bind and do its job. This is like changing the lock so the key no longer fits. Another reason is off-target resistance. Here, the cancer cells activate different pathways or signals that help them grow even when the main target is blocked. They might turn on alternative routes like the Ras-MAPE or pi 3 degrees Kelvin pathways, which keep the cancer alive and dividing. It's similar to taking a different road to reach the same destination when the main road is blocked. Tumor heterogeneity also plays a role. Lung tumors are made up of many different types of cancer cells. Some of these cells might be resistant from the start, or they may acquire resistance over time. This diversity means that while some cells are killed by the therapy, others survive and eventually cause the tumor to grow back. Sometimes, the cancer can change its appearance or characteristics, a process called histological transformation. For instance, it might shift from an epithelial type to a neuroendocrine or mesenchymal type, which might not respond well to the original targeted therapy. This change can make treatment more complicated. The tumor microenvironment, which includes the surrounding cells and immune factors, can also influence resistance. Changes here can protect cancer cells or suppress the immune system's ability to fight the tumor, making therapies less effective. When targeted therapy stops working, doctors usually perform re-biopsies or liquid biopsies. These tests look for new mutations or resistance mechanisms, helping to decide the next steps. Based on these results, new targeted drugs might be used, especially if specific resistance mutations are found. For example, third-generation drugs are available for certain mutations like T790M in the epidermal growth factor receptor gene. Sometimes, switching to different targeted therapies or combining multiple drugs can help overcome resistance. Clinical trials are also an important option, offering access to new treatments that are still being studied. If targeted therapies are no longer effective, other systemic treatments like chemotherapy or immunotherapy might be considered, depending on the patient's overall health and tumor features. Throughout this process, supportive care remains essential. Managing symptoms and maintaining quality of life are always priorities. It's important to remember that resistance is a complex and common part of lung cancer treatment. Ongoing research aims to better understand these resistance mechanisms and develop more effective therapies. If you or a loved one face this challenge, always work closely with your healthcare team to explore personalized options and stay informed about new advances.